A pacifier is very good, especially to keep a child quiet. I think that's what parents go for it. That's the main reason why parents go for it. Let me keep the child quiet. Let me also be able to keep the baby away so that I can have my rest. Maybe, most of the time, when the child is sucking on that pacifier, they are quiet because it also provides a lot of comfort for the child. And then I can say that it helps the child to sleep much longer than the child would without a pacifier. But with acquisition of all these kind of toys, I don't want you to look at one side only. You must look at one, the pros, which are the advantages, and then you must also look at the cons, which are the disadvantages. I would say that I wouldn't necessarily call these disadvantages. I would say have a look out when you are buying a pacifier for your kid. The first thing is the fact that a lot of kids have had instances where they choke on the pacifiers because the parents tend to go and do something else or engage in other activities when the child is in that calming state. And there are instances when the child would choke on it, and it could be dangerous, especially for infants and the very young ones. And so when you are buying it, at least make sure that the base or the bottom is it should be at least 1.5 inches. Okay, so that you have done your part in ensuring that the child is safe, so that the child will not choke. And then one thing also that the pacifier can do that I have observed is the fact that it brings about what we call nipple confusion. And I'm going to explain that in a minute. So the
So just
nipple
a quick thing, you said that the pacifier should be about 1.5 inches, but for a lot of us we
the
cannot
base
think
of
in
it,
inches.
the
The
base
base
of
of
it.
the base,
Yes,
yes.
please.
A lot of us cannot think in inches. So how can
Mhm.
you relate the size of the mouth of the baby?
Okay, I think a parent's thumb could be a rule for measurement. Just make sure that the base is at least the size of your thumb, from the tip to the bottom of your thumb. Where's my thumb? Yeah, please, can you see my thumb? Yes, so
Can
you
you raise
can
it?
do from
We
there
can
to
see
the
that
bottom.
clearly. Okay, okay. So that's a good
Yeah.
one.
Mhm.
So that's a
Then you
good
know
one.
that
Thank you.
it's big enough not to go inside, I mean, the base of it, because obviously we want the tip to go inside the child's mouth, but the base should be big enough to block the child's mouth so that it doesn't go further down, especially in awkward positioning. And we have to be very careful when the pacifier is in the child's mouth. Watch the position that you place the child. The child can't be down like that, and then there's a pacifier. And if the child is struggling to breathe, it will be difficult for the child. So rather use positions that are better, like try to sit the child upright or a little bit propped up. At least the head should be a bit elevated so that we know that the child is safe, especially for the very young babies. So another thing that pacifiers tend to do that we don't look at is the fact that it gathers a lot of germs. It can pick up a lot of germs, and some of them, especially the fancy ones, have parts that are not easy to clean. And we must understand that the babies don't have a strong an immune system to be able to fight off some of the, let's say, basic everyday germs. So when you are having a pacifier, at least pay attention to it like you would do with a baby's bottle parts. If you need to boil it together with those things that you boil to sterilize, if you have a sterilizer, make sure that also goes in because it gathers a lot of germs, and most of the time, because it goes straight into the mouth, I mean, it's like if the germs are on, there's no two ways about it. It's going down. And I mentioned the nipple confusion, and that has to do. Please, may I continue?
Continue.
Okay.
The floor is yours.
All right. So that has to do with because of the similarity of the feel and the look and the touch of the nipple and the pacifier, it's actually a preferred way of getting food in for the children. It's much easier, you know. It's so much like the tip of a feeding bottle. So you just put it in your mouth and then you have the comfort that you need. So the children that have not learned to suckle well enough, if you introduce the pacifier too early, they might not want to suckle. And I mean, they might not want to suck the breast milk like they should, because that technique of sucking the breast milk is a little bit more complicated than just putting the pacifier in or drinking from the bottle of the feeding bottle, I mean.
So
And
this
then,
issue of nipple confusion, this nipple confusion is
mm,
it sounds a bit it sounds a bit strange to a lot of us, because I remember on my channel I did a video on nipple confusion, and when I
mhm.
released it, I put it in a women's group, and people actually came out and told me that I was telling lies. So a lot of us have not heard about nipple confusion, but nipple confusion
Mhm,
is there. Nipple confusion is basically that your baby is confused between what is a pacifier, what is a
mhm,
breast nipple, and what is a
mhm.
bottle nipple. And when a baby has nipple confusion, that can actually make you stop breastfeeding before
Yeah.
you are ready to stop breastfeeding, before your
Mhm,
baby is 6 months old. So nipple confusion is real. I have personally seen it in my practice as a pediatrician.
mhm,
But because this awareness is not there, a lot of people don't know about it, don't even
mhm.
believe it, but it is there and it is real. And one of the
It is
things you should do to make your breastfeeding journey a successful one is to delay the introduction of a pacifier. If you
of
are
the
going to introduce
pacifier.
it, you should delay it until your baby is conversant with breastfeeding, and until you yourself are also conversant with breastfeeding. Because usually for us first-time mothers, it takes a while for the mother to get used to breastfeeding, and the baby as well. The position and everything
Mhm,
is tricky. So you should delay the introduction of a pacifier until both you and your baby are conversant. I have an
mhm.
age in mind to give you, but I don't want Mildred to say that what I'm saying is not true. So I won't give an age. I will just
Oh,
say that babies learn at different rates. Make sure your baby is conversant before you
yeah.
introduce a pacifier. So I'm very happy that you have brought this today. So those who told me that there was nothing called nipple confusion, just
Oh,
realize that it's not only pediatricians who say it, the occupational therapists also say
it's also
nipple confusion.
saying it. Yes, yes, yes. All right.
And let
Thank
me say
you.
hi to Paul, Aram, Linda, and Godfred. Thank you for joining us today.
Oh, thank you. Hello. Okay, so another thing, let me just add one more thing with the pacifier. It's very comforting, very easy to use. So even when the time comes for the child to stop using the pacifier, sometimes it becomes a bit of a challenge. So when you take the pacifier away, they will go for thumb sucking. So you take the pacifier away. The easy thing to put in the mouth is the thumb. So it's also a way of encouraging the child to thumb suck. And we know the difficulties that come with thumb sucking. If you put your fingers in your mouth for a long time, prolonged thumb sucking can lead to a couple of dental issues. Even the child is possibly going to develop an overbite, you know, because the thumb being in is also guiding how the teeth should develop and how the dental arrangements should be. So it can have an effect, not a very big effect, but it can have some effect.